Hello, my name is Dr. Adnan. I am working as a Registrar Urology at King Edward Medical University, Mayo Hospital, Lahore. Today we are going to make another video on MRCS examination. I am going to make a video on MRCS Part A examination. I have made a video on Part B examination. You can follow on my YouTube channel and see video about MRCS Part B examination on my YouTube channel. Before starting about the MRCS Part A, I want to tell what is actually MRCS. MRCS is a membership of Royal College of Surgeons, and it consists of two parts, Part A and Part B. The Part A is a written part, and the Part B is a clinical part. In this video, we are going to discuss about the pattern of the exam, and then we will discuss about the passing marks and cost of the exam, and what resources should be used for the examination, and how many sittings are allowed per year. And we are also going to discuss about the time duration and some special MCQs and some special topics that are frequently asked in the examination. Now we will discuss about the format of exam. It is actually a 5-hour exam divided into the two papers, paper 1 and paper 2. The paper 2 is about the applied basic sciences. It consists of 180 single best MCQs and 1 minute each to attempt the MCQs. And if you don't know the answer about any specific question, you can skip that and answer that question at the end of your session. And paper 2, it's about the basic. It's actually about the principle of surgery in basics. It consists of 120 MCQs, and there is also 1 minute each to attempt each question. And if you don't know the answer of any question, you can skip that question and answer that question at the end of your session. Now, a lot of people ask how many times the Royal College is conducting exam in a year. They are usually conducting 3 times in a year, in a calendar year, usually in the month of January, April, May, and in the month of September. There are 4 Royal Colleges: Royal College of Surgeons of England, Royal College of Surgeons of Glasgow, Edinburgh, and Royal College of Surgeons of Ireland. It's an online examination. It doesn't matter from which college you choose from to give your Part A examination. It is inter-colleges that conduct exam at the same time, and the paper is same for every Royal College. Now we will talk about the passing marks and cost of the exams. There are slightly different changes from 1st April 2025. There will be an increase in fees in both Part A and Part B examination. It is around £600. Now from 1st April 2025, it's gonna be £625. If we convert into Pakistan, it's around 250 lakhs, 2.5 lakhs per 2.5 lakhs. And passing criteria, it's generally considered around 70%. Nowadays the exam is getting very difficult. A lot of people are trying to give this exam. Their trend is slightly changed from PLAB to MRCS, MRCP and MRCM examination. First it was considered to save if you secured 75% marks. Now the exam passing marks, they are gradually decreasing. They are going in a decreasing trend as the difficulty of exam is increasing day by day. A lot of candidates ask about when should be the Part A examination be given. What is the ideal time? I think the ideal time for give the Part A examination when you are giving your intermediate modules. Most of the surgical residents, they are giving their intermediate module examination. So you are preparing for one exam, and by preparing for one exam, you can give this examination. I will discuss in detail about the paper B, the basic of surgery in general. You can give this exam after your graduation. There is no hard and fast rule about you have to wear any training, any experience. You have just your basic medical graduation, and you can give this examination. But the more you get the surgical experience, the easier you find the answer and question in your exams. Now we will discuss about the syllabus of both paper 1 and paper 2. In paper 1, they are going to test your applied knowledge, basic knowledge. In applied basic knowledge, they are going to test about your applied surgical anatomy, applied surgical pathology, applied surgical physiology, applied surgical microbiology, applied surgical pharmacology, imaging, and data interpretation and audits. Now we will discuss about the syllabus of paper 2. In paper 2, they are going to check about the congenital and acquired condition, surgical condition, perioperative management and assessment and management of the surgical trauma patient. They are also going to discuss about the medical legal aspect of the surgical practices and the surgical care of the children. It is going to test in your paper 2 exam. To clear your exam in the first attempt, you should identify the high yield MCQs and high yield topics. So you should focus on that topic so that you get highest marks and clear your exam with ease in first attempt. So in applied basic principles, there are 180 MCQs, out of which 75 MCQs they are going from anatomy segment, 45 MCQs from the physiology segment, and 35 from the pathology segment. Similarly, 8 MCQs they will be from pathology, 7 from microbiology, 5 from the imaging segment, and 3 MCQs will be from data interpretation and audits. So as you can see, there are a lot of MCQs from the anatomy segment, 75 MCQs. So one should be very focused about the anatomy. Or if he or she is big in anatomy segment, he should focus and thoroughly study the anatomy segment. Now another important question: how much time is actually required to ace the exam? So with your residency and with your job, and you are busy in the morning time and you have time only in the evening and night, so I think 4 to 5 months they are enough to pass the examination without any hindrance. So I actually divided my 4 to 5 month time into the 3 halves. For first revision, second revision, and the last month I just book my last one for any revisions and any past MCQs. So in the first 2 to 3 months, you should complete your first revision and you should go through your entire syllabus with studying 4 to 6 hours per week. In the second month, in the second half, or in the second month, you should revise your syllabus. And in the last month, you should focus on the past recalls, Fauci sheets, Omama sheets, and you should try to memorize, and you should try to focus on your mistake rather than investing and rather than studying about the new topics, as studying in the last period of time for searching for new topics can be very fatal. Now the important thing to ace any exam and to clear any exam is the ideal and very efficient resources. They are very key point. If you don't choose the right resources, you are not going to clear any exam. It's an online examination. It is very different from the examination we are giving throughout our medical life. We are giving the examination on the paper sheets, but this exam is I think the first exam you are going to give in the online pattern. So you have to be very clear about this examination. It's a very technical exam. You can clear with this exam with no shortcomings. You can clear this exam if you follow the exact pathway. Now we talk about the resources. The main resources for paper 1 is if you are good enough for anatomy, your anatomy knowledge is very good, you can use the MRCS. MRCS is an online banking system. You can use that. There are 22 MCQs. These are not only the 22 MCQs, these are actually the 2200 topics. We have to thoroughly go through that topics. So for anatomy, if you can study, should study the Snell reviews and EMRCS portal and Raftery. There is a medical book which is usually people recommend, that's the Edin Raftery. It cover all your aspect of anatomy, physiology and pathology of paper A. Now for anatomy, you should study, if you have a good grip on anatomy, you should study from Snell reviews or Raftery, or you can also use the MRCS for your practices. For physiology, if you have good grip on physiology, you can only study the Raftery and do the MRCS. And if you have some weakness in your physiology segment, you can study from the BRS physiology. They are just the reviews book. They are not the standard book. They are just the review book to memorize and to recover your basic knowledge about your anatomy, physiology and pathology segment. For pathology, I usually recommend Raftery and EMRCS online examination pattern. And the other topics is about the pharmacology, microbiology, imaging and data interpretation and audits. They can be covered from EMRCS only. And similarly for paper 2 is the principle of surgery in basics. So if you are a surgical resident, you should study unit 3 and unit 4 of the Bailey and Love. The unit 3 is about the perioperative assessment, and unit 4 is about the trauma. You should thoroughly study the unit 3 and unit 4. It is not going to help you in your MRCS Part A examination. It is also very helpful in clearing the intermediate module of the FCPS or any your MS examination. The day you spend in your ward, they are going to be very helpful, because you are seeing the patient, surgical patient on the floors, on emergencies and in ward. They are very, the MCQs in the Part A examination of paper 2, they are very similar to these. Though we have discussed that the main resources is the for paper 1 is Registrar, MRCS online portal, and then we should use for anatomy for Snell review, for physiology BRS review, and for paper 2 you should study from Bailey and Love unit 3 and 4 and MRCS online portal. In the last month, the most important thing is the past recalls. One should at least do the recalls of last 5 years. They are the key point in getting your exam, in clearing your exam. And for this sheet, there are 300 MCQs. They are very important MCQs. And there are also memo notes. They are one-liner MCQs. So you should start studying these memo notes or for this sheet from the start of your preparation, so that by the end you don't get very annoying that you are studying for the first time. And there are some online apps from which you can get the MRCS Part A recalls, and there are also some YouTube channels, especially the Rami Yusuf and the Harbi. You can get you can get the idea, and you can also get the clearness about the topic from these two channels. I usually follow these two channels. So this is all about the resources. Like Part B, you need a partner practices to get to practice about the examination and history. But in Part A, you just have to the more question you try it online, you attempt online, the more you get familiar with the pattern of the exam, the more you get comfortable. This is the complete guideline about the MRCS Part A examination. If in case you need any question, need any help, you can comment below on my video. So I will be available anytime. So I will be answering your question. So I try my best to cover all the aspect about the MRCS Part A examination. In case you need any question, any help, you are feel free to contact. Thank you so much.